Hello, Mr. Smith.
Yes.
Hi, my name is Megan. I'll be your nurse today.
Nice to meet you.
I'll be performing your physical assessment. Is that all right with you?
Yes.
Wonderful. I'm going to step over here, go ahead and do some hand hygiene, washing my hands. Wonderful. Okay. So for the purposes of this assessment, I've already determined his age versus appearance, his nutritional status, grooming, as well as position and posturing, speech affect, his mentation, he's alert and oriented. Speech pattern is good, and vital signs of pain have also been assessed. So I'll go ahead and take a look at your hands. I'm first going to inspect your skin. I'm looking for color, vascularity, checking the nail beds. Very good. No presence of lesions anywhere. And for palpation, I'm checking temperature, skin moisture, turgor, which is skin elasticity. Everything looks nice there. Are you having any pain or tenderness?
No.
No, and no lumps or anything like that. Wonderful. Move on to examine the scalp by starting with inspection. We're going to look at the scalp for shape, size, and contour, and symmetry as well. I'll go ahead and palpate for any lumps or bumps. Any tenderness there, sir?
No.
No. We're also going to examine the skin integrity of the scalp, and the skin assessment will continue throughout the entire exam. And the hair distribution, hair texture, we're looking for scaliness or possible infestation, which there is none. Wonderful. I'm going to go ahead and examine your eyes, just giving a look. Good. Now, if you'll just look straight ahead, I'm going to inspect and look at the shape and size, contour of the eyebrows, eyelashes. Wonderful. Go ahead and look at my finger for me. I'll check your pupillary response, which is also inspecting cranial nerve 3. Just keep straight my finger, sir. Very good. Good. I've also examined the conjunctiva, the sclera, and the cornea. I'm going to wash my hands before proceeding to palpation of the eyes. Washing hands. Good. All right, so I'm going to palpate the lacrimal sacs and glands to check for any tenderness or discharge. You having any pain there, sir?
No.
No? Wonderful. Now, I'm going to go ahead and have you follow my pin light. I'm going to check your extraocular eye movements, which are cranial nerves 3, 4, and 6. Very good. Follow the light. Excellent. Wonderful. Any pain or discomfort with that?
No.
No. Okay, great. I'll go ahead and hand wash my hands and change out my gloves again. And next we'll move on to the inspection of the ears for this exam. And again, we will start with inspection, which is visualizing the ears. We're looking at the shape. We're inspecting the auricles, the tragus, and the lobes. Everything looks good. Symmetry is good. We're just also looking for any lesions or deformities. I'll begin with palpation of the lobe, then the auricles, the tragus, and the lobes as well to check for mobility and tenderness. Any pain there, sir?
No.
No. Wonderful. And no discharge either, which is good. In the final component of the ear assessment, I will perform the whisper test. Or would you repeat after me with what I whisper into your ear?
1, 2, 3.
Excellent.
4, 5, 6.
Good. He passed. Wonderful. All right. Moving forward, we will examine the nose. First, I will inspect and look for alignment. Good. And positioning, which everything looks great. I will then palpate for skeletal integrity. Good. And also any tenderness that may be present. Are you all right there?
Yes.
Wonderful. Next, I will go to palpate the frontal and maxillary sinuses. Any tenderness?
No.
And then maxillary. Tenderness there, sir?
Nope.
All right. No lumps, bumps, or any deformities there, so that's wonderful. Could I please have you place one finger on one side of your nose and breathe in and out? Okay, and then the other. All right. So that shows me that both nares are patent and open and functioning. I'm just going to take a look up his nose to examine the septum for any deviation. Very good. Wonderful. I'm going to go ahead and wash my hands again for safety precautions' sake and move on to the patient's mouth and pharynx. Are you warm enough, sir?
Yes.
All right, good. I want to keep you comfortable as possible. So I will begin by examining his mouth by inspecting. I'll first examine the lips. Wonderful. Go ahead and open your mouth for me. And say ah.
Uh,
Good. I am inspecting all components of his mouth, including lips, buccal mucosa, gums, teeth, which include the number and condition. And say ah. Good. Hard palate and soft palate look appropriate. Tonsils, uvula, and the posterior pharynx. Now, if you will say ah one more time. Good. With the phonation of ah, I can tell that the cranial nerves 9 and 10 are functioning properly with the movement of the posterior pharynx and uvula. Go ahead and ah one more time. Go ahead and stick your tongue out for me. Good. And we go ahead and test the cranial nerve 12 with the projection of the tongue, which the patient is obviously doing very well at. Okay. Wonderful. And then I will take a piece of gauze and I will palpate the tongue. Go ahead and stick your tongue out. Good. I'm checking for moisture, texture, color, and the presence of lesions. Excellent, sir. Go ahead and wash my hands again. Now, I'll move forward from his mouth into his face. I will start by inspection, noting the contour and shape of his outer face, which everything looks good. The skin assessment is continued. We're processing for lumps and lesions, which is fine. We're going to have you please make a face for me. Could you puff your cheeks? Very good. Relax. Lift your eyebrows. Good. Squeeze your eyes really tightly. Excellent. Now the puffing of cheeks and raising of eyebrows lets me test cranial nerve 7, which we can see is intact. Now I will also perform a sensory test to test cranial nerve 5. If you will please close your eyes and let me know when you feel my touch.
Yes. Yes. Yes.
Wonderful. And in accompanying that test, I will test with sharp and dull touch. So I need you, sir, to differentiate between soft touch and sharp touch with your eyes closed.
Okay. Salt. 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 Sharp. Sharp.
Very good. Wonderful. Okay, so moving forward from the face, we're going to check the neck. Okay, we're going to start by inspection. I'm looking for alignment and the proportions of the neck and trachea to look for deviations, which it looks very good. You'll turn it up to the side. Good, wonderful. And I'm going to also palpate the neck to test the thyroid, to feel for any abnormalities or bumps or tenderness. Any tenderness there, sir?
No.
All right. Now, a further assessment of cranial nerves 9 and 10 will have the patient take a swallow. Would you like to have a drink of water, or are you okay to swallow? One more time. Very good. Any tenderness there?
No.
Wonderful. Okay. Now to test cranial nerve 11, I will place my hands on the sides of his shoulders and have him raise up against me. Good. And this is testing the trapezius and sternocleidomastoid strength, which he passed with flying colors. Okay. Wonderful. So next, moving on from there, we will check the lymphatic system, and I will, in an ordered series, go through each of the lymph nodes to test for any swelling or growth that might not be normal. So I'll start with the pre-auricular. Good. Post-auricular. Occipital. Good. Tonsillar. Submandibular. Good. Submental. Good. Cervical chains. Good. Then we will assess both the supra and infraclavicular. Good. If I could have you put your hands on your hips like so I can test all 4 nodes within the axillary region. Good. If I could have you just lay back briefly, I'm going to check your inguinal lymph nodes. Providing for patient comfort and privacy, I will keep the sheet there. Go ahead and open your legs up a little bit, sir. Very good. Okay. You can go ahead and have a seat back up for me. Sorry for making you move around so much. Wonderful. Now I will go around to the back of the patient to do an assessment of the posterior chest. So go ahead and turn. If you could stand, go ahead and just turn for me, and I'll have you hold the sheet around your waist. Yep, like so. Go ahead and face this back wall. Good. All right, so first I will begin with inspection, noting the shape, contour of the back of the chest. I will note the transverse versus AP diameter, which should be 2 to 1. looking for any deformities or nodules, which looks good. I'll proceed for palpation, which I'm going to check for any tenderness, lumps. Any tenderness, sir?
No.
No. Take a deep breath for me. Good. And that allows me to assess for thoracic expansion. I'll move on from palpation to percussion of all lung fields, starting from the top. Good. And then to test for CVA tenderness, I will percuss at the costovertebral angle. Any tenderness there, sir?
No.
No? All right. So next I will auscultate the lung fields bilaterally. Just breathe normally for me. Very good, sir. Please have a seat. Excellent. So we'll repeat those steps for the anterior chest. Beginning with inspection, again, I'm going to note the size and contour of the anterior chest, noting any presence of lesions or skin abnormalities. Wonderful. And then I'm going to palpate again for tenderness. Any tenderness, sir?
No.
No lumps are present. Go ahead and breathe in. Good. And again, that is assessing for thoracic expansion. So, moving on from there, I will also percuss the anterior chest. And then to make sure to check for spleen engorgement. Good. Now I will auscultate the lung fields in all lobes bilaterally. Very good, sir. All right, so now that we've assessed both the posterior and anterior chest, I will move on to the heart assessment. First, I will visualize the precordium, noting any pulsations, lifts, or heaves in the area, which would be signs of abnormal findings, which I do not see. Next, I will place my hand over the apical region to see if there are any abnormal pulsations or feel for a thrill, which there are not. And then finally, I will auscultate all areas of the heart to listen for both S1 and S2 in all areas, including the aortic. And I'll do this with both the bell and diaphragm. The pulmonic. Tricuspid. Good. And mitral. Very good. And you can assess this third component with a patient in one of three positions, seated, standing, or laying down. Are you doing okay so far, sir?
Yes.
Good, wonderful. So I'll move on from the heart to assess the peripheral vascularity system, inspecting first the color of the skin, noting any vascularity issues, which we've checked before with the capillary refill. I will look down the body and check for any edema, and also clubbing of the nails. Wonderful. And also in palpation, you can check again the temperature and moisture of the skin, which would note the circulatory status. Everything looks very good. I'll go ahead and move from top to bottom, feeling his pulses, starting with the carotid. One at a time with the pressure. Good. Brachial. Good. Radial. Good. And then femoral. I'm just going to slip under here. Good. Posterior tibial. And last, dorsalis pedis, or pedal pulses. Very good. All equal and strong bilaterally, which is excellent. And if you're comfortable remaining seated, I'll go ahead and start with your abdominal assessment.
Okay.
So first I will inspect the abdomen, looking at the color, shape, again, skin assessment in presence of scars or distension. I will look for any pulsations in the area, which would be an abnormal finding. I would also note the area around the umbilicus, if everything looks good. And with the abdominal assessment, we want to auscultate before percussing or palpation. So I will listen in all 4 areas, starting with the right lower quadrant and moving around in a clockwise pattern. Very good. I'll follow this by percussing each of the quadrants. Very good. This will be followed finally by the palpation above light and deep in all 4 areas. Tell me if you have any tenderness with this. Very good. Excellent. Wonderful. So moving on from abdominal, we will move to the musculoskeletal, which we are already going to view all of the muscles in the body and the joints to see if there's any obvious deformity, looking for shape and size and contour, noting any nodules or differences in shape on either side. I'll go ahead and have you lift up against my hands. Good. And rotate your shoulders around for me. Good. Now, bend and extend your elbows. Good. Wrists. Fingers. Good. I'll go ahead and move to your knees, and then we'll do your hips afterward. Ankles and toes. Good. Now pull up against my hands. Good. And push down. Very good. And now hold your hands out like so. Press down and lift up. Very good. Now in this series of exercises I've asked, we've assessed the joints, all major joints of the body. Also, could you move your neck around for me? Any tenderness there? All right. We've checked all major joints for pain, tenderness, warmth, or crepitus. And then also we'll finalize with the grip strength. Very good. He grasped bilaterally and equally. And then we'll have him please stand up for me, holding your sheet. And then you can just move your hips from side to side. Any pain with that? No. Good. Notice if you'll face the other way, I'll examine your back. Good. And for the musculoskeletal portion with the back, we're examining the color, the alignment, we're checking the spinal processes, and also checking for tenderness. Any tenderness there?
No.
Good. You step back for me and just try to bend over and touch your toes, which is assessing the range of motion and strength in that area. Any problems with that?
No.
Good. Go ahead and turn back around. Have a seat. Excellent. Wonderful. So the musculoskeletal system has been assessed for strength and range of motion as well. So we'll finalize the assessment with the neurologic assessment portion. Now, as we've talked about throughout the assessment, we have assessed various nerves already, with cranial 2 assessing the optic nerve with the sight. We've also assessed the extraocular movements with cranial nerves 3, 4, and 6. We have assessed the light touch of the face, which would signify the proper functioning of cranial nerve 5. And then with cranial nerve 7, he was able to blow out his cheeks and raise his eyebrows. With the protrusion of the tongue, his cranial nerve 12 is intact. With the ability to raise his shoulders against my weight, was showing trapezius and sternocleidomastoid strength, which was proper functioning of cranial nerve 11. Very good. Now, if you will for me, sir, just hold your arms out straight ahead of you, palms up, and close your eyes, and keep your arms out straight. Now, this is called the pronator drift test. This is assessing cerebellar functioning. And as you can see, he's holding his arms out straight ahead of him without any drifting of arms, which means that his functioning is appropriate. Very good, sir. Excellent. Now, if you go ahead and stand up for me, and all you need to do is place your feet together and close your eyes and just hold your balance. Good. Now, this is the Romberg test. Stay standing for me. And that's another test of cerebral functioning. I'll have you take a few steps forward to prove to me that your gait is working well. Good. Turn. Excellent. Any balance or feelings of dizziness?
No.
Okay. Now I'll have you watch my finger, and what I want you to do is bring your own finger to your nose and touch it, and then touch my finger. Very good. One more time. Right. Very good. Now, if you will, just have a lay down for me. I have another neurological test to do. I apologize about the bed quality. Keep it covered up. Now, this is the heel to shin to toe test. So what I'll have you do is bring one heel. I'll start with your right. Touch it to your shin, and I want you to slide down your entire shin to your toes and bring it back up. And do this about 3 times, keeping your foot in that same alignment. Very good. Now you're going to switch and do the opposite with the other leg. Up the shin. Very good. One more time. Excellent. How did that feel? Good. Go ahead and sit up. The final element of our neurological exam will be deep tendon reflexes, both bicep and patellar. So if you will allow me to rest your forearm on my forearm, we'll find the tendon there. Try that again a little bit. Try clenching your teeth for me. Good. So a little bit of a reflex on that middle finger. We'll repeat the other on the other side. Good. Excellent. Now for the patellar, if you'll scoot up just a little bit so your feet hang. Good. Very good. Excellent. So we can see that all reflexes are normal within normal limits, as well as range of motion and muscle strength, as you scored a 5 out of a scale of 0 to 5. And if you have no other concerns today, sir, you've checked out with a clean bill of health. Okay, and is it all right if we use this assessment for school purposes?
Yes.
Absolutely. Well, I hope that you have a wonderful day, and I thank you for your time.
Thank you.
All right.